Hello, how are you? Welcome to Nurse Coding Training 2018. Our learning objective for today will cover four topics of coding: a sick call visit, where we will cover evaluation and management 99211, an immunization visit, and we also will cover two topics that I will call reason for visit codes in both wound care visit and health and education visit. In the big scheme of medical coding, there are two very important code sets that we will be mentioning here today. ICD codes are mainly called the diagnosis code, but here in our case, I will mention they are also used to clarify a reason for a visit, a condition, and in many instances, a sign or symptom. The other code set mentioned today are CPT codes. In almost all locations, they are used, such as in hospitals, doctor's offices, urgent care centers, surgical care centers, etc., for the procedure or services that are rendered. But here at IHSC, we use them to establish workload, for we do not bill out anyone for services. Leadership will be using this workload data to determine manning and budget. First on our list for today is the sick call visit. This is where I find this information very relative to. Per the coding guideline, nurses need to use evaluation and management 99211. This is an office visit of an established patient that may not require the presence of a physician. The presenting problem or the reason for the visit should be documented. However, it needs only to be minimal severity. I have shown some examples for the reason of the visits, such as injections, suture removal, dressing changes, blood pressure check, and patient's vitals. Let's talk about immunizations next. I have provided a ICD code Z23 that you can use for any immunization encounter, which would explain that this is the reason for the visit. This should be added to each patient's medical record. Also shown here are two CPT codes for the immunization itself. The first one, 90471, would always be listed first and is auto-populated in ECW. The second CPT shown, 90472, is what is called an add-on code and is to be used for when there are two or more immunizations given at the same time. Here are 5 examples of 5 immunization codes that we use here at IHSC often. This slide shows you 2 examples on how immunization visits should be coded. First, we have a 10-year-old boy seen for only one immunization of MMR. Notice in this case, we will assign the ICD code Z23 for the visit, for the reason for the visit, along with two CPT codes, 90471 for the administration and 90707 for the immunization itself. So for this example, we have one ICD code and 2 CPT codes. Next, we have a 5-year-old patient seen for an immunization of varicella and a Tdap. In this case, we would once again assign our ICD Z23 for the reason for the visit, then CPT 90471 for the administration of the first immunization, followed by CPT 90472 for the administration of the second immunization, followed by CPT 90700 for the immunization for the varicella, then CPT 90716 for the immunization of the Tdap. So for this example, we have one ICD code followed by 4 CPT codes. Let's look at wound care. Here I have provided 4 ICD reason for visit codes. These will show the type of service rendered for different type of wound care visits that you may encounter. These codes can be added to the medical record. Z48.00 for non-surgical wound dressing, Z48.01 removal of surgical wound dressing, Z48.02 change or removal of staples, and Z48.03 for removal of drains. For these reasons for visit codes, no CPT code is listed. These are more considered aftercare codes from procedures that were done at a different time. For example, follow-up from an incision and drainage, lacerations, and ulcer wound follow-up. Our final subject I would like to speak about is on health and education codes. I would consider these to be more like action codes that can be added to the medical record to describe the healthcare and education that was provided. First, I have given examples of a few that are not as specific and could be used for many reasons, such as Z71.89, other specified counseling and coordination of care, such as diabetes mellitus, and the treatment such as insulin use. The coordination of care for the use of an EpiPen for patients with bad allergies, asthma and treatment, such as how to use a nebulizer. This code may also cover a broader category under adjustment to a life-threatening illness. Code Z71.2 for a patient consulting for explanation of examination or test findings. All of I have seen we offer here in ECW. We have the reading of the skin PPD test, the TB blood test, blood pressure readings, blood sugar readings, and sexually transmitted disease results. Codes Z72.9, problem related to lifestyle unspecified. Looking through ECW, I have seen these things such as separation from family, loss of a loved one, and a traumatic event such as a gang rape victim. On this next page of examples, the codes are more specific to what the counseling and care is for, such as alcohol and drug abuse, HIV counseling, and education. I am sure this would involve the drug regimen for this patient that would hopefully work best. There are a few more added codes listed here that I believe are self-explanatory. In today's summary of this presentation, we went over many ICD and CPT codes and reasons for their usages. We also covered under sick call visit, evaluation and management CPT 99211, used for an office visit and for nurses. Extensively covered immunization ICD and CPT codes and gave examples on how they are coded. Also covered here today, ICD codes that we call the reason for the visit in wound care and health and education, and shared some examples. I appreciate you listening to this presentation today. If you have any questions, please feel free to contact me at any time. I have provided my name, again, Lori Knockett, along with my email, my work phone, and my cell phone. Thank you very much, and have a great day.